Scrutiny Committee on the 9th of December 2021. Just to make you all aware, today's meeting will be recorded. Can I also welcome any members of the public and press to today's meeting? Can I kindly ask you to observe the meeting only and not speak or participate? I would also like to welcome members of the Education, Skills and Culture Scrutiny Committee who have been invited to attend today's meeting. Can I please remind you all to switch your phones to silent for the duration of the meeting? In addition, can I refer you to the protocols for remote meetings which have been previously circulated, namely, your microphones should be switched to mute unless you are speaking. Should you wish to ask a question or make a comment, can you please indicate either via the chat function or by raising your electronic hand via Teams? I will assume that you have all read the paperwork before us today prior to the meeting. Please only use the chat function to indicate if you wish to speak as an alternative to the electronic hand function or to raise any technical issues. When asking a question, can you please indicate which page number you are referring to? The first item on the agenda is to do a roll call. I am Councillor Lynette Purcell, the Chair, and I am present. I will now call on Chloe, the Democratic Services Officer, to take the roll call.
Thank you, Chair. I've marked you as present. Councillor Charlotte Goldsworthy. Councillor Charlotte Goldsworthy. Chair, I can see she's. Oh, yep, she's just confirmed. Thank you. Councillor Arthur Davis. Councillor Arthur Davis. Nope. Councillor Oliver Davis.
Present, thank you, Chloe.
Councillor John Miller. Nope. Councillor Suzanne Patterson.
Present.
Councillor Sonia Reynolds.
Present.
Councillor Dave Whitelock.
Present, thank you, Chloe.
We've had apologies from Councillor Arwen Wilcock. Councillor Carolyn Edwards.
Present, Chloe.
Councillor Wyndham Griffiths.
Present, Chloe.
Councillor Helen Clark.
Present, Chloe.
And Councillor Nicola Davis. Councillor Nicola Davis. Nope. Cabinet members, Alan Lockyer.
Present, Chloe.
Sir Peter Richards.
Present, Chloe.
And then we've had one indication from the education members, which was Councillor Suzanne Renkeys.
Present, sorry.
That is okay, thank you. Chair, I can also see that Councillor John Miller is also in attendance, so I'll mark him as present. And then officers, Andrew Jarrett.
Present, Chloe.
Angela Thomas.
Present, Chloe.
Kerry Warren.
Good afternoon, present.
Thank you. Councillor Chris Frey, oh, sorry, not Councillor, Chris Frey Davis.
Present.
Thank you. Mike Potts.
Present.
Dave Hardin.
Present.
John Hodges.
Present, Chloe.
Shelley Howard.
Apologies from Shelley.
No worries. Sue Bradshaw.
Present.
And then I've got some education officers, I think. Chris Millis.
Present, thanks, Chloe.
Alison Davis.
Present, thanks, Chloe.
Emma Hargest.
Present, Chloe.
Gloria Smith.
Present.
Gareth Evans. Karen Jackson. Nicola Edwards.
Present, thank you.
Deanne Martin.
Present, thank you.
Andrew Bartholomew. Dean Llewellyn.
Present.
Way. Ellie Isaac. And Chris Edwards. Is there any officers that I've missed who are participating in today's meeting? Oh, I can see Adrian Bradshaw.
Yeah,
I'll mark you as present. Yep.
Thank you.
I think that's everyone, Chair. Thank you. Oh, I can see someone else. Is it Noon?
It's Noonay. Hello, good
Noonay. Hello. I'll mark you as present as well. Thank you, Chair.
Thank you. Can I just ask, the two people who didn't answer were both in the pre-briefing. Can we check that they haven't gone into the wrong meeting?
Councillor John Miller is in attendance now. And I think the other one was Councillor Arthur Davis and Councillor Nicola Davis. We'll try and get them into the meeting, Chair.
And is the Vice Chair there? Because I have a feeling she didn't answer either.
Yeah, she did briefly on
Yeah.
mute. Yeah.
Oh,
I'm here.
brilliant. We're as much present and correct as we can be expected this close to Christmas. Right, okay, here we go. We have two items on our scrutiny agenda today, which we will look at. One is in public and the other is in private. We've decided to scrutinise items 6, 7 and 12 of the Social Care, Health and Wellbeing Cabinet Board agenda. We've chosen not to scrutinise Cabinet Board Agenda 9, Development of an Independent Living Hub at Bespoke, as we are happy with the recommendation contained within the report. However, at this point, the Vice Chair would like to make a comment. Vice Chair.
This is something I really welcome. Obviously, many people who know me well enough knows I'm very passionate about this area and obviously this facility as well. Sorry about the dog. Bear with me. And basically what I think is that the two people that we've since passed away were very passionate about this as well, Nicola and Lisa. And I just think it's a real good honour for their memories for it to be going forward. I did also see that it was mentioned about the funding hasn't actually been accepted yet, which I'm very confident it will be on that. But however, if not, I think it is also a really important facility that would be a good investment, even if it is from our own capital funds as well. So it's something that I would like the committee to support, regardless where the funding comes from, to make sure it goes ahead. That's it.
Excuse me. Councillor Paddison, did you want to indicate? Sorry, did you want to speak?
Yes. Sorry, Chair. Maybe a little confused, Chair. On the scrutiny committee agenda, we are on that one, yeah? No.
We haven't started yet.
Item 6 is to choose.
Can I just explain what we're doing? At the moment, because I'm sticking absolutely religiously to Chloe's notes, I'm doing the Chair's announcements, which is announcing what we're going to scrutinise.
Right. Okay.
But we've said we didn't want to scrutinise that particular item, and because the Vice Chair wanted to make a comment, she's made that comment. But I can see Angela Thomas indicating, which may be that she wants to respond to what the Vice Chair has just said. Am I right, Angela?
Correct. Thank you, Chair. Just to say thank you, Councillor Galsworthy. It wasn't actually done in memory of anyone, but it is actually thank you for those fitting words. We will progress. I am confident that we'll get the capital monies for this. It is a fantastic opportunity. Sue Bradshaw, Principal Officer here with us today, has been leading this piece of work. The request was for 90 days consultation, but thank you all for supporting it.
Thank you for that. Right, before we move on to declarations of interest, are there any other items contained with the agendas that we haven't mentioned that members may wish to scrutinise? This is for those people who weren't able to attend the pre-briefing, or are you happy to proceed? Can't see any indications, so we shall carry on. Declaration of interest. Can members please indicate whether you have any declarations in relation to the items that we have chosen to scrutinise? Chloe will circulate a declaration of interest form via email for you to complete. Anybody? Oh, I can see Chloe indicating. Chloe?
Yep. Cheers, just to confirm that Councillor Arthur Davis and Councillor Nicola Davis are both in the meeting now.
Brilliant, thank you. So, declarations of interest. Anybody declaring? No, we're okay, so we're okay to carry on. Oh, phone call, don't worry, my partner's taking it, I hope. Yes, he is. Brilliant. he has his uses. Right, we're now up to the minutes of the previous meeting. As we discussed in pre-briefing, there are 2 sets of minutes on the agenda for approval. However, we've decided to defer the minutes dated the 16th of September 2021 until the Democratic Services Officer returns, who wrote those minutes, as we have some confusion about some of the wording on the minutes. We're not happy to approve them at the moment. But for the minutes dated the 21st of October 21, which start on page 9, can I ask if any members have any comments on the accuracy? And if not, can I have a proposer and a seconder to approve the minutes? Any comments? Can I have a proposer, please?
I propose.
Thank you. And to second?
I'll second, Chair.
Thank you very much. Right, we're now on to the scrutiny papers for anybody who's trying to catch up here. We're on agenda item 5, which is the delayed transfers of care and community pressures. The reporting officer is Angela Thomas. Angela, do you have anything to add, or shall we move straight to questions?
Happy to move straight to questions, Chair. This was our trying to provide an overview. We weren't absolutely clear what committee we're asking for, so this was our attempt at providing an overview of where we're at in residential domiciliary care, etc. within Neath Talbot. Happy to go to questions.
Thank you. Suzanne, you're indicating with a question. I'll bring you in just a couple of seconds, because what I wanted to refer to first of all as the chair is to thank the officers for their attempt at trying to give us an update on this, and to say that we totally sympathise and support adult social services staff and carers at all levels. We know that you're in a very, very difficult situation, and we thank you for a no holds barred detailed report. Okay, in pre-briefing, I did have Councillor Helen Kerry-Clark to come in, and then we'll follow with Councillor Paddison. Councillor Clark.
Chair, what I'd like to know is, in relation to this report, have you considered, because I know that there's an exemption in exceptional circumstances to employ family members with direct payments. Has that been explored? Because I do know that a lot of people would maybe give up a job if they knew they could get paid for looking after a family member. Has this been explored in any length? Because we are in an exceptional circumstance.
The answer to that is yes. We promote direct payments, and we do have, I think the bulk of our direct payments are family members and PAs. So yes is the answer.
Are you okay with that, Helen?
Great, I'm really pleased to hear that. Thank you, Angela.
Great. Councillor Paddison, Suzanne.
Oh, thank you, Chair. Yeah, my question, first of all, before I do the question, I would like to comment on the layout of this report. I thought it was brilliant, the way it was all different sections. It was a very easy read, so thank you, Angela. You know, it was a difficult subject to sort of tackle, but I think the end result was well worth it. So that being said, my question, and I'm not sure if you will be able to answer it, because it was on the part where people ready to be discharged from hospital would be taken away from their bed and to the exit lounge. And I wondered, when they're in the exit lounge, who looks after them there? Because it could take several hours for transportation or a bed or home care to be sorted out. So who looks after the people who are in the exit lounge awaiting a discharge?
It's health staff.
And so their responsibility is not when they discharge from the bed, it's when they discharge from the hospital.
From an acute bed into a discharge bed, into a discharge lounge, yes.
Yeah, that's fine. I just wanted to make sure that I'd read that, you know, and that was okay. Thank you very much, Chair.
Thank you. As we said at the beginning, we really appreciate this report and the fact that it is no holds barred. But because of that, we do need to pick up on something that you've said on page 23, where we're noting the difficulty in finding places for service users with dementia who need a care package or a placement. Therefore, bearing in mind we are the Scrutiny Committee, we just wanted to ask, in a worst case scenario, what would happen if you couldn't find a placement or a care package?
Fortunately, we haven't been in that position to date. Where we will end up, and it is probably readmission to hospitals. If we can't find any provision whatsoever in our communities, then it says in the paper we're already at that position where we're having to offer families a placement in interim extended care residential. It's not where we want to be, but that's the paucity of care that we have currently. And can I just say thank you for your comments on the report. I won't take all the credit. Adrian pulled quite a bit of this together.
Thank you for that. Coincidentally, Adrian is now indicating. Adrian.
Yeah, just to add what Angela just said, I think in those types of situations which we do find ourselves in, we do keep looking and looking and looking until we can find a bed. So we go further and further afield. So we go to our neighbouring authorities until we can source a bed. So particularly on those more challenging areas where we do have some issues sourcing beds, we do look outside of the county as well, to Swansea, Bridgend, and some on occasions where we've had to go further afield. But we keep looking until we can find situations if they are desperately needed.
Thank you for that clarification. Thank you. On page 28, the Welsh Government guidance refers to local community coordination hubs. We've heard all sorts of terminology in the last few years, but what are they and are they working? Page 28.
Gosh. I'm not absolutely 100% certain if this is a health document that we've attached here, isn't it?
Okay.
Yeah. Okay. I mean, I'll explain what the hubs are. We've got some pilot hubs at the moment where we have multidisciplinary professionals coming together. So you have your district nurse, your doctor, GP, etc. And it's happening now as we discharge people from a hospital bed. Those multidisciplinary meetings are having prior to somebody being discharged home. So we're working out where best that person's pathway is. That's largely where it is. Don't profess to be a master at what this says in the health documents.
Right, that links to the question I had about page 31. Again, this is the health document, it's the Welsh Government guidance, but it says a lead professional or multidisciplinary team will need to visit patients at home on the day of the discharge or the day after to determine what support is needed and rapidly arrange for that to be put in place. Now, we'll all agree that sounds absolutely brilliant in Welsh Government guidance. But do we assume that this is not always possible to happen?
It is happening. This is something we live and breathe daily. We have what's called a daily huddle, a meeting where Adrian will attend it with hospital staff, community staff, etc. We are very clear and very keen that we're part of all of those meetings because we don't want people being discharged unsafely or without the right package of care. It's getting more and more difficult. We have got alternative methods now where we can move people from an acute hospital bed into an interim residential care bed while we're awaiting a package of care. And to date, we've moved 15 people on that pathway, 4 of whom have gone home with a package of care. 1 has remained long-term in residential care and 10 are sitting in a residential bed awaiting a package of care. That's the situation we find ourselves in.
I'm really glad we asked that question because that's very, very reassuring. I presume there's a few nodding heads coming from the committee. That is really the sort of thing that we want to hear. Excellent. Congratulations on that. Excuse me. Simple question, page 38 refers to additional funding available to local authorities to cover any increased cost. Is the funding forthcoming and is it helping?
Yes and yes.
Brilliant, that's a nice simple one. Right, there's no recommendation and it's simply for noting. So we're now moving to the cabinet papers and I'll give you just a couple of seconds to sort yourselves out. I was suddenly reminded of my teaching career when I used to say to children look up when you're ready to carry on. So when I can make eye contact with you all, then I know we're okay. Right, okay. Agenda item 6 on the cabinet is to do with safeguarding. And I think at this point, as this is so much in the front of so many of our minds, we have to refer to the fact that this report is very timely, as it comes so soon after the awful reports of the death of young Arthur. And I think we feel collectively responsible, all of us, that this should have been allowed to happen. And if this report wasn't coming to us, I'm quite sure the committee would be saying, can we have a report on safeguarding of children to make sure that an Arthur cannot happen in Neath, Talbot? So I just wanted to acknowledge that tragedy and to welcome, therefore, the number of positives in this report. And I want to go through all the positives because this has been a journey, as the director knows, this has been a journey, and it's a good journey. We have some questions, but we also have a lot of compliments as well. So we wanted to comment on page 8, which refers to a positive and proactive approach to safeguarding. Well, that is just fantastic. Page 8 is also talking about the shared ethos with the third sector. And page 22 refers to Bernardo's being a good conduit between the police and social services. That's also very reassuring. Page 9, the staff themselves are reporting on supportive leadership. Page 14, and so many on the committee are grateful for this, plain language and the acronyms being explained. Although, having said that, we did have to keep flicking back to page 14 to see what some of the acronyms meant, but thank you for that. Page 23, we recognise the relatively low number of those not in education and employment or training in the county, and this is coming about through the good work between Youth Service and Careers Wales. And finally, page 28, we were interested to read that the LA is described as being forward-thinking and testing new ways of working and in being involved in projects with academia. So, I mean, I could carry on with that list. There's a lot of positives in this report. However, our job is to scrutinise. So, first of all, simple question. Andrew, in layman's terms, can you explain what contextual safeguarding is?
I can, Chair, but there are better people more able to do that than I am. And I don't know whether Kerry wanted to do some form of really brief introduction to this, Chair, only because safeguarding isn't something which the local authority can do itself. It relies on its partner agencies, and there are a number of partner agencies on the call today, ready to answer questions if necessary, but also to hear from councillors about their feedback on the report, which is a very positive report. So Kerry will be able to talk about contextual safeguarding in much better detail than I can, but she also might want to just say a bit more about this report and how positive it is.
Thank you. Yeah, I forgot to bring you in, Kerry. I'm very sorry. I'm so excited because this was such a good positive report. Right, Kerry, take it away.
Thank you, Chair. I mean, as Andrew's just said, really, we are really pleased to be here today. The inspection was during the summer. It's a pilot, so it's the first of its kind in Wales. I'm really pleased you've talked about Arthur. I will take every opportunity to talk about him up until Christmas and next year. So I'm pleased to tell you today that there's myself, the head of service for education, Chris Millis, is also with us, along with some of our partner agencies. So that, so within Children's Services, obviously, we've also got Youth Justice, but we've got probation, the police and health, as that it was a joined up inspection with regards to child protection. We are a humble bunch, but I think it's important for you to note that I would say in my 34 years of being a frontline sort of child protection, social worker, manager, senior officer, and now head of service, this is the best inspection, the best report that I have ever seen. And it's down to our own team and to the to our colleagues and partners within Neath Talbot that allows us to work together and to achieve the kind of recognition really that came out from the JICPA. So them, they are here, they will step in and answer questions. And with regards to your question around contextualised safeguarding, we've got our lead for safeguarding, Chris Frey, today, and I must make special mention to Chris. Chris is our lead for safeguarding across the directorate and sort of a corporate lead, and he played a huge part and plays a huge part in bringing this partnership together and making it the success that it is. So now that I've built him up, I'm going to field that question to him with regards to contextualised safeguarding, simply because he leads on it and he'll do it much more justice than I could. But thank you for that opportunity.
Thank you. I think it's just the terminology. We really would like an explanation. Take it away, Chris.
No, thank you, Chair, and thank you for reflecting the positives that come out of this report. I was hoping you would ask that because it was going to lead into an offer of a presentation to members in recognition that you do all sit across the various wards across Neath Talbot, and in order to make Neath Talbot a safe space for our young people, we also need to recognise the part that you will play and the support you bring to the table in terms of making our community safer. But in very brief terms, contextual safeguarding is an approach to understand and respond to young people's experiences of harm and risk outside the family home. So what it seeks to do is expand the objectives of our current child protection system, which is traditionally focused on harm inside the family home, and of course is right to do that, but it also recognises that young people are vulnerable to abuse beyond their front doors, and the contextual safeguarding approach does look beyond parents. So I think whilst there are partners around the table today who can field questions, hopefully the difficult questions, I might add, in respect of the report and what you wish to ask, it's really important to recognise that parents are also key partners in relation to how we build capacity to safeguard those young people. And in addition to that, as well as looking to yourselves as local councillors, we do need, and we are working with the wider community safety partnership to look at how others can intervene to create safe spaces for our young people. So beyond the traditional school, health, probation, police, we're also linking in with our licensing department, with our waste management, with our youth services, with housing, etc. So that's it in a very kind of broad overview, but more than happy to present and give you a more overview about the work that's going on across Neath Talbot, because it's a hive of activity which is really exciting for us at the moment.
I think the committee would very much welcome that. Perhaps we could put it into our forward work programme. Chloe, where are you? Yes?
Yes, Chair, we can do that.
Yeah.
If that's okay, we'll sort a date with officers for that.
Yeah, because we really would like to know, all the nuts and bolts of what's going on, I think, far more than you could actually put into this report. Right, brilliant. I can see Councillor Paddison indicating.
Chair, I'm willing to take in the queue if somebody notified in pre-briefing. It's up to you.
Yes, okay, right, that's fine. We'll
wait my turn.
Carry on through the list then. Page 8 and page 19 refer to the need to improve co-production of safety plans with the young people. I'm sure you're going to tell me progress is being made with this, but can you just answer that for me? For us?
Yeah, I'm happy to pick that one up, Chair. So as you'll see in what is a really comprehensive action plan, again, an action plan that's been developed across the partnership with colleagues around the table today, there is a specific action whereby we are looking at how we engage young people, how we engage parents to ultimately bring them around the table as early as possible. So the plan ultimately is theirs, and we support that plan moving forward.
Thank you very much for that. Right. Page 26, we can't duck this one. There's a major criticism of the police and their use of NAIRAs, which is not at immediate risk, and it also refers to lack of communication. Now, with the Social Services, Health and Wellbeing Committee, and we've got the Education Committee members here as well, we're nothing to do with the police. So we just wondered who is responsible for this criticism being addressed, and will any progress on that criticism be reported back to us?
Hi, Chair. It's Dean Llewellyn here, Detective Chief Inspector from South Wales Police and Swansea Neath Talbot PCU. I can certainly provide a bit of context to that and perhaps offer some reassurance regarding how NIRA is currently being reviewed and assessed. So NIRA, no apparent immediate risk absent, is a category of missing that was brought into South Wales Police to try and, one, break demand in terms of operational policing, and two, to look at more effective ways in which we can safeguard young people who might be at risk of harm. So there was a pilot process within South Wales Police. The pilot scheme proved to be a great success, but it's not without criticism, and it's not without areas for further development. Whilst I was in a previous role within Public Protection Headquarters, I commissioned an academic study to review the NIRA process over the next 12-month period, and also not just the NIRA process, but our overarching response to missing, to see how we can develop that and how we can improve our response across the whole of South Wales Police. And obviously that'll play a big part in how we address that within Neath and Talbot area as well. So just to offer some reassurance, this process is being looked at with great scrutiny, not just from within South Wales Police, but from academic partners from Liverpool University who are experts in this field. And we hope that they will add real value in relation to that response, and to look at any areas of development that need amending and need improving as the process develops over time. So whilst it's in place at the moment, and I'm not saying it won't be in place further down the line, just to offer reassurance that we're looking at those areas where we've received justifiable criticism, and we'll be looking at how we develop that moving forward.
Thank you, and welcome. I didn't know you were with us. Very nice to see you here with us. I know that Councillor Kerry Clark has a specific question to do with this. If we go to her next, and then to Councillor Paddison.
Chair, yes, it mentions coordinated police disruption tactics. Could you tell me what they are, please?
Right, so in terms of, you'll have to excuse me, I've come into this meeting so relatively late on. So coordinated police disruption tactics. So, for example, these can be used in terms of those to protect children and young people who we believe are at risk of exploitation and harm from perpetrators. So disruption tactics, we have a number of those within policing, and they are utilised as methods really to address and to proactively target those who we deem to be exploiting, those at risk of exploitation and who might be vulnerable.
Are you happy with that, Helen?
Chair, if I could come in just to add really, because in fairness, our partners have come in and they're supporting us in scrutiny. I guess for us it means we've been really successful in Neath Talbot, where we've had worries about some particular young people where they are at risk of exploitation, and the police have been very proactive in identifying the adults that are causing the concern, and being very proactive in arresting them, getting them out of the community. So that's the disruption. You know, we're keen to make sure that young people that are vulnerable and live within Neath Talbot, stay within Neath Talbot. They stay where they, within their own communities and stay within their own families. The risk is in relation to the grown-ups, and so the police have been very proactive. Historically, in other local authorities, you will see in similar situations the children are removed, and those adults that are causing harm stay in their communities, and all that happens then is that they move on to another child or young person. But in Neath Talbot, the police are very proactive in working with us to cause that disruption to the person who's causing harm, and that shows itself in lots of different ways.
That's very reassuring. Thank you for that, Kerry. Suzanne, you're being very patient, but I have a feeling that Chris and Alison, who are both indicating, might want to come in on this particular question that Helen has asked. So, Chris, can you take it away? Chris Frey-Davis?
Chair, I was just going to add in relation to Councillor Clark's question, the answer is long, and more than happy to build into that presentation the disruption kind of toolkit and kind of everything at our disposal, really, to obviously make Neath Talbot a safe space for children and young people.
Brilliant, very good idea. Right, we'll add that on in. That's brilliant. Alison, did you want to come in on this specific point?
It was only just to echo what Chris is saying, really, so nothing to add except some of the techniques we use are around contextualised risk, core notices. The police work hand in glove with us in terms of the Youth Justice Service, so basically adding to what Chris is saying around his presentation for contextualised safeguarding.
That's excellent, and it's certainly very reassuring to hear that. Helen, I know you put a second question, but Suzanne's been so patient. Should we bring in Councillor Paterson, and then Helen, you have your second question. Councillor Paterson.
Oh, thank you, Chair. As members of this committee will know, it's been a bugbear of mine for several years, and I've raised it before in committee about children who regularly go missing but regularly turn up. Yeah. And I know that the director was very keen to engage Barnardo's because it was told to me that the police don't get, the children won't talk to the police when they come back. So therefore it was felt that Barnardo's would be a better fit for them to speak to them about where they've been, what they've been doing. But being as that we do have a police officer here today, I would like to know, when you know that a child goes to a regular place, and I do think that, the not immediately at risk comes into this, that you know where they are and you know that they will eventually come back and they usually are free from harm. But what investigations do you make about the place where they've been and the people that they've been? It is you do pick the children up and bring them back home. Occasionally, sometimes they come home themselves. But what do you do about where they've been? What investigation happens? Thank you.
Yes, thank you, Councillor Paterson, and Chair, if I can try my best to answer that. A really, really important point that you raised there. And that is key to us and in how we develop and improve our response to missing young people and children. And you're right, I think in the past we've probably missed opportunities when we haven't really looked into those addresses, those associates, and the risk, the threat, risk and harm that's associated with those individuals and those premises. So that is a key part of that academic piece of research that I've commissioned for South Wales Police. And moving forward, we really hope that will help build, one, a better police response, but most importantly, an effective partnership approach moving forward, so we can really target those who are exploiting and those addresses that are causing additional vulnerability. So, yeah, to try my best to answer that, it's an area that we need to improve upon. I think that Barnardo's advocates, you're absolutely right. Young people and children who have gone missing or that might fall within that so-called NIRA bracket, they don't want to speak to police officers generally. And I completely understand that. And ultimately, one thing we've tried to move away from within the police is we've tried to reduce the unnecessary involvement of police officers when we don't actually need to be involved. So I don't mean we're sort of shirking away from our responsibilities. What I'm trying to say there is that we're trying to de-police or decriminalise our response when it comes to talking to children and young people, so that they are seeing somebody who's more supportive and perhaps they trust more than a police officer.
Yeah, if I may just quickly come back, Chair. I think you mentioned in an answer to an earlier question a 12-month period. In the next 12 months, you said things. 12 months is an awful long time in the life of a child who may or may not be at risk. Why does it take so long?
Well, what we want to do is ensure a thorough academic programme. So what we've got 3 master's students engaged in a 12-month process. So that's looking at holistic missing response within South Wales Police. You're absolutely right to Councillor Patterson. 12 months is a long time in a child's life, but it doesn't take that long. We're amending and reflecting upon our processes on a continual basis. So whilst that 12 months will offer a full holistic review, it's ongoing and it will remain so.
Pleased to hear it. Thank you.
Thank you.
Chris, is that a legacy hand or is it a new hand? Did you want to come in on this?
No, just to come back in on that point. I'm sorry, Dean. I did say, if you could join us today, I didn't think you'd field all the questions. So thank you for that. But just to come in on that, in that whilst police, yes, have powers in terms of intervening, in the spirit of the contextual safeguarding approach, and you'll hear the mantra, safeguarding is everybody's responsibility. Well, the contextual safeguarding approach expands that now to creating safe spaces for children and young people is everyone's responsibility. So yes, there are things police can do, as can we, as can health, as can education. But as we move this forward now, we are really targeting persons of concern, places of concern. And as a local authority, what we're saying to partners, to members of the public and to yourselves is, if you are worried about a person or you are worried about a place but don't have the details of a child, refer it in and we will have a look at it, and we will get it to a place whereby we can have the right people looking at it in terms of if it's a park, if it's an area, we can look at officers to then consider risk to young people in that particular location, etc.
Thank you for that. Helen, you had a second question. Councillor Clark.
Yeah, I did. I've got a third as well now. Sorry, Lynette. On page 32, it says, we did not see consistent evidence of the shared implementation and review of safety plans. I appreciate you've got an action plan. Could I just have an outline on how you're going to do that a bit more? Because obviously reviewing safety plans is extremely important. And my third question was, I agree with you, Kerry, this is a really, really good report. Are there any plans for anybody to do this for the safeguarded adults, specifically those who lack capacity and those who have drug and alcohol dependencies?
Okay, so if I take your first question, and I'm with you, if there is a plan, something written down on a piece of paper doesn't keep children and young people safe. It's a live document. It must be a working document that's not just shared with children and families and partner agencies, but co-produced with children and families. So, I am a worst critic, but I would say to you that we do that, generally we do that pretty well. But, on the examples that the inspectors seemed they were right to bring that to our attention, we took immediate action in response to that. So that I can give assurance to Scrutiny today that all children's plans are working documents that involve children, families and partners and are being co-produced. So I think we probably didn't do ourselves justice. I think it was probably a better picture than the inspectors saw, but that's certainly something that we picked up as our highest priority, to be honest.
Thank you. Did you want to come back with the third question, Helen, about adults? Councillor Clark, where have you gone?
I'm here. Do you want me to repeat the question?
Yeah, yes, please. Yeah, I want to see which officer is going to take this one up. Right.
Oh, right. Yeah, this is a really good report. But I'd like to know if there's any plans to do anything similar with adults safeguarding, specifically in relation to those with lack of capacity and people who have drug and alcohol dependency.
Right, now that's not specifically related to the report in front of us, but it's a good question. Obviously, we're not expecting a detailed answer, but Director, could you possibly come in on that?
I'm happy to come in on it, Chair. I don't know of any plans for that to happen. I mean, this was the first time this has been done, or sorry, the second time, as Kerry said. It's a pilot, but they're going to continue to do it as far as children are concerned and the safeguards and child protection arrangements. I haven't heard that they're going to expand that into the adult world. But I suppose once once they've worked through how all of those different inspectorates start to work together and inspect effectively, then that's surely the next step, which is inspecting more areas on a multi-agency and a multidisciplinary basis. I mean, Chris Frey might know more than I do about that, but that's my understanding from speaking to Welsh Government and the Inspectorate at this time.
Great. So before we come to Chris, as a committee, we therefore would like to say more power to your elbow in encouraging that to happen, because we have found this an excellent report, not just because the results are good, but because of the multidisciplinary nature of the report. So yeah, push for that, and we're right behind you. I can see Chris. Better bring you in next, Chris, and then go back to Councillor Paddison. Chris, did you want to comment on that?
Yeah, just to say that partners around the table cover over children and adults, or I think most of us do, and the certainly the work that we've done in terms of embedding contextual safeguarding in children, we see the potential for it to be move over to adults, so the work we do around transitioning, and then those that don't have capacity, but equally those that do have capacity, insofar as if you are being exploited and are deemed to have capacity, well, I think we would argue that somebody being exploited, controlled and coerced probably can't make the decisions we'd expect them to during such time. So there are conversations going on at the moment about how we move now to look at taking this approach into adults, because the principles apply in terms of targeting people of concern and places of concern in respect of adults.
Thanks for that, Chris. Councillor Paddison.
Thank you, Chair, and I must make apologies. I saw a chance to come in with my bugbear earlier on and completely forgot about what I really wanted to say. So the report is absolutely amazing, considering the base that we were once in this council. You know, I was on the committee when it wasn't so good. We did have a change of director, and hats off to you, Andrew, and your senior team. It's very difficult sometimes being a lay member of the committee, asking questions. You think you think everything's okay, you hope it is okay, but isn't it lovely to get a professional's opinion like this? You know, this is a wonderful report showing that in this council we don't see it as just a social services problem or topic, or not problem, but, you know, a topic. And I know with my other hat on that even taxi drivers have had training about, you know, if somebody is taken to a regular place at a regular time, or things to look out to about safety. So I commend Andrew for the ethos that you've spread within the council for safeguarding and your senior team. It is very good to see so many links in with partner agencies mentioned in this report. So well done. Thank you.
Thank you for that. Andrew, you're indicating?
Yeah, thanks, Chair, and thank you, Councillor Paddison, for those kind words. This has been a multidisciplinary endeavour, so I can't take the credit for this at all. And of course, as director, I'm further removed from the Children's Services now. So I suppose what I would say, Chair, is that as I started with, this is, you know, one of the best inspection reports that I've seen in my career. We did have 17 inspectors who came and had a really good look at the whole of the multidisciplinary approach to child protection arrangements. And whilst I would expect my children's services to come out as well as they did, because I know how hard they work, etc., it was fantastic to see all of the other agencies coming out as well, so well, and our joint endeavour being recognised as being so good. Of course, there will be things that we've got to learn, and we will learn those lessons. And I just wondered, Chair, so you know, very, very proud of Children's Services, but also their involvement of health, probation, and the police, which you see in the report. You know, very good overall. But in particular, when I read the report, what stood out for me was the was the attitude and the approach of our education colleagues, and the way that they dealt with their child protection arrangements and the culture that they'd set up in order to within the council in order to promote that. And I think that's really important. And I haven't seen anything as positive from education inspectors than I saw on this report. And I wondered, Chair, whether it would be possible, once people have answered the questions that you've got, whether we could just ask those representatives from those agencies to just give a commitment to the committee around what they've learned, but actually just to give a comment on the process. But particularly because I know Chris from education hasn't spoken yet, and I think a lot of the credit for the education would go to Chris Millis and the way that he's driven forward that as head of service. And so I don't know whether he's got something that he would want to say at this stage.
Thank you for that, Andrew. I think that's a good idea as a summary when we come to the end of this report. I have got one more question that was previously indicated from the Vice Chair, Councillor Goldsworthy. If we take that, and if we basically go round the virtual table and ask if any officers present now who've been involved in this would like to say anything, then that would be good before we come to the recommendation. So, Councillor Goldsworthy.
Hi all. I second what Suzanne Patterson have said this afternoon, totally, especially to see everyone's gone from strength to strength and working collaboratively. I might even say co-productive, Andrew, you never know, right? But I doubt it, not yet. But it's been excellent. And I think also it's the good relationships the council has also got with officers, and how we can just pick up the phone on time, same as the cabinet members also. Just before I ask the question, I just want to come back. It was something that Councillor Patterson said in regards to the work you've done on taxi drivers, which I applaud. But also, in past meetings, I've gone on sometimes about how looking outside a house with lots of waste outside and mental health issues and things like that have come up, can identify a lot of things, a lot of troubles maybe. And another thing would be where, say for instance, our environmental team have telephone calls in about, say, vicious dogs. A lot of the time, vicious dogs comes with a lot of issues around, obviously, drug issues and vulnerable people, etc. And I haven't heard the terminology lodgers and young people with vicious dogs lodging with 8-year-old men. So again, I think calls can come in to call centres. And again, I'd be interested to know, is there any safeguarding training that actually have gone on also with any of the call centre teams? So that's my first question. And my second question is obviously just, I think it's page 39. And it's where, just an update really, because there was concerns about the waiting list at the moment to get in on CAMS. So just wanting to know, is there any more information you can share with us on that, please?
Thank you for that, Councillor Goldsworthy. I was expecting the question about CAMS, where several agencies have said that the CAMS waiting lists increase the risk of harm to the child. So I know that we wanted to know if there was any progress on this. But your other question is an interesting one about call centres and problems. Anybody feel like answering that one?
Chris has come in very quickly.
Whoever that was.
You know, I like an awkward one. I like
out of the mouth of babes.
Can I just say, Chair, that I think what you
in control of this meeting was that Kerry. Yes, yeah, Kerry.
What you're seeing in action today is how we generally behave, and I think when you talk about partnership and building relationships and working together, this is what you're seeing. So we're all kind of keen to respond. In fairness to our police colleague Dean, we've not met him before, and he's come on to our scrutiny committee and is fielding the questions. And I think that's the culture that's been created. So Chris will do this much more, justice than me. Even though I chair the meeting, it's a corporate safeguarding group where Lynn Doyle leads on training. And it's a really good question from Councillor Goldsworthy, because they are all of the things that we talk about and work out how best to respond to, and recognise really the need in terms of training. It's not just your traditional people that we would have trained previously. So I'm going to bring Chris in if you're able to give us a little bit more detail around some of the wider staff group that have been trained, Chris.
Yeah, no, so we last week we met as a community safety partnership, so colleagues from across obviously the local authority, and I presented to raise the profile of contextual safeguarding. The next step now is to roll that training out across all of the individual departments across the local authorities. So yeah, as Charlotte talked about, so the corporate centre, waste management, environmental health, because you're right, there are things people will see, but then the question for us is, well, what do you do with that when you see it? What are you thinking when you see it? And then if we can just plant in their minds that there are things going on across Neath Talbot that we really want to get a grip of. So if I say criminal exploitation, county lines, well, they are all eyes and ears, some good soft intelligence, but it allows us then to build that picture and then as a partnership target a collective response to that then. So yes, training will be rolled out. It'll be joint training to raise the profile and make sure we're all on the same page.
Thank you. That again is very reassuring. It's this cultural shift, isn't it? I can remember years ago when I first was elected to the council talking about trying to break down silo thinking. And this is the ultimate breaking down of silo thinking, in that somebody's saying, right, there's really a problem going on at this house, but I'm just a waste refuse collector. It's nothing to do with me. But if everybody is the eyes and ears, then that's real progress. Right, I did see our police officer indicating who's gone away again, but I can see Councillor Patterson. Did you want to come in, Dean?
Thank you, Chair. Yes, it was just to reiterate there really what Chris and Kerry mentioned. We're constantly looking for new and emerging sort of areas of threat, risk and harm that we can target. So that was a really good point there raised by Councillor Goldworthy in terms of other areas that perhaps we haven't looked at in the past. So certainly we're constantly looking at having that dialogue around those new and emerging areas of threat, risk and harm.
Thank you. Councillor Patterson, is it a legacy hand or is it a new one?
No, it is a new one, Chair. It was just leading on from the questions that were just being asked. If you remember, when I was sitting on the Fire Authority, and it was 4 years ago at least now, Chris Davis, Chief Fire Officer, was very keen for fire officers who go into people's houses to do safety checks, to be able to report to local authorities on anything they saw which they felt might need further investigation. And I mentioned it at the time when I was on the authority. I don't sit there now and I'm not on public protection. So I just saw an opportunity to sort of ask the question again, do we work with members of the Fire Authority, Mid and West Wales, to get reports from them about anything they feel when they go in to do the safety checks for fire? They have detailed access to people's houses and they are trusted. People I'm sorry about the police, but the fire service are not treated in the same way a lot of the time. No. They are the good guys sort of thing, and people will allow them into their homes, and I just wondered if that was happening. Thank you.
That's a very good point. Chris, do you want to come back on that? Cabinet member, I can see you, but I want to let Chris reply to that.
We do. We have good relationships with our colleagues in the fire service, and Diana Harris sits on our local operational safeguarding group. And it probably is important to share, given the timing of obviously the most recent tragedy, that on any neglect case, we have an automatic referral to the fire service as well. So they go out and do home visits in terms of all of the neglect cases we're involved in as well. So yeah, we're involved, and they are referrers to us as well.
That's excellent. Thank you.
That's very, very good news. Cabinet member.
Thank you, Chair. Yeah, I just wanted to thank the committee, and particularly Suzanne and yourself for the kind remarks to our colleagues within Children's Social Services. This is, as I think Susan pointed out, a completely different service, because we now work in a completely different way. Knowledge is essential. If any child protection case or any serious case review, it's always, communication. Why didn't this one left hand know what the right hand was doing, etc. We've learned from those tragic cases, and thank goodness we've not had that sort of situation within Neath, Talbot. But you've got to take these things on board. But I think you're also not taking yourself as a committee into this for all, because actually the questioning and the the scrutiny of our officers, which they welcome, by the way, is what keeps not them on their toes, but it's an opportunity for them to show off, if you like, how well they're doing. To produce are you going to see later on Andrew's report? You see reports coming in regularly from Chris or Kerry or whoever it is, all our officers. They're not thrown together on the back of a fag packet, to sort of coin a phrase. They take a lot of preparation and thought, and it's got to be accurate. It can't be just something thrown together for the sake of a committee. I think we've moved well away over the last X number of years from that situation where Suzanne talked about. And yes, I have to pay tribute to Andrew and Kerry and the team, because they're the ones that consistently done that. In my professional career, I've seen lots of people come in. I mean, to be fair, we were in such a bad place. The only place we could go was up to some extent. But going up is one thing, but maintaining it and continually improving it is something else, and that's what takes a good leader and a good senior staff, because we've got to a point where the social services being recognised for Wales as being one of the best, if not the best, but it continues to improve, and that's the thing, is to maintain the standard, but keep improving on it is something else. And I've got to make, I wouldn't normally speak in this committee, and I don't mean to hog anybody's time, but the fact that, as Andrew pointed out, the police, health, education, we're all working together, because knowledge is power. Knowledge is something that we all need to make sure to try our best. I think Chris actually quoted Munro, Professor Eileen Munro, to me this week. It was surprisingly hard to develop a high accuracy rate in predicting a relatively rare event, when we were talking about poor Arthur. But we are doing our utmost, absolute utmost, to make sure wherever we possibly can that doesn't happen in Neath Talbot. And it's only done through this collaborative working. And I would say it's co-production. I'm sorry, Charlotte. This is a pretty good example of co-production. So I just want to thank the committee for your scrutiny within children's social services, and also thank Andrew and his team for not only getting this to the peak we're at, but continuing to improve and us being internationally recognised. I mean, it'll get to a point where Kerry Warren won't speak to us for long, because she's in any more papers doing interviews. It'll be, it'll be just too much. But no, thank you, Chair. Thanks for your indulgence.
Thank you. I am a little bit anxious to move progress, because I know we've got a couple of other biggies that we need to look at, and I would like to do the round table. Councillor Goldsworthy, is it a comment or is it a question?
No, it's a comment back to Alan.
Right.
Alan,
Is
it's
it
not
about
about co-production, it's actually about the meaning of it. It should have been happening years ago, not a buzzword.
Yeah. Thank you for that, Councillor Goldsworthy. Right. A quick round table of any officer that's been sitting here patiently for a good 3/4 of an hour who would like to say something. Chris Millis, for example, would you like to come in?
Thank you, Chair. Yes, I would. Thanks. We've said a lot about the document itself, and it is a straightforward document to read through. The work that went behind it, we haven't actually mentioned. It was at the height of a pandemic as well. While this inspectorate came to us, instead of us pushing back and saying no, we welcomed them in. 5 different inspectorates coming together. They found it difficult to work together. They'd never done that before, but we didn't. When I first came out from headship into the authority, the word multi-agency was bandied around, but it wasn't really thought through. We now have effective multi-agency. From a school point of view, I've encouraged all our school staff, whoever they are, to recognise signs of safeguarding at whatever level that is, to think the unthinkable. That's what our training's about. They have to think the unthinkable, to take responsibility for their action, and to ask for help. And I find it quite easy to ask social services for help, whether it's through a SPOC or multi-agency work, corporate safeguarding. because we now work as a team, because we have the child or the family at the centre of the decision that we're going to make. So I wanted to thank social services for coordinating it. We had 2 very experienced HMI Eston inspectors that were realistic as well, and that helped because they listened to what we were trying to achieve. And we're just trying to make each school, each area, each park, each street as safe as possible. Can you ever truly be safeguarded? The answer is no, but it shouldn't stop you from trying. Thank you, Chair.
Thank you very much for that summary. That was excellent. Right, before I move to the recommendation, is there anybody else? I don't think so. So I'm particularly grateful to those people who've come to the committee that are not normally here. It's been wonderful to have people coming, particularly from the police. We very much welcome that, and I'm sorry if you were put on the spot, but there we are. And we have a recommendation on page 14. It's only to note, are we happy to note the recommendation on page 14? Yes, lots of thumbs up. Excellent. Oh, Andrew, did you want to say something?
Yeah, very briefly, Chair. Thanks to everyone in the committee for the questions. So this was also, and you've asked the questions about the action plan, and no doubt the committee will want to see the action plan in 6 months' time with the updates from then.
Yes, please. Thank you very much for that. Right. Okay. We are up to cabinet member agenda. Sorry, not cabinet member. I don't know where I am. Cabinet papers, agenda item 7, right, which is the Q2 performance report, children, young people and adult services, April 21 to September 21. It's Angela and Kerry. Have you anything to add, or do you want to go straight to questions?
Chair, sorry to interrupt. Would you mind if those that aren't part of the next set of instructions can step out the meeting now?
Yes, please. Yeah, do by all means go.
Thank you, everyone.
Thank you very much for attending. Right, so wherever we are, yes, we're on cabinet member agenda item 7, and we have got Angela and Kerry. And would they like to say anything before we begin?
No, happy to go straight to questions, Chair.
Right. Again, we have positives, lots of positives. I just wanted to highlight a few of them before we go to questions. Page 58, the high number of child assessments completed on time being higher than the Welsh average. That's very reassuring. Page 62, the number of households prevented from becoming homeless, again, excellent. Page 66, the fact that no complaints were upheld, an increased number of compliments in children's services. Page 71, we were particularly pleased to see that there are no agency social workers currently being employed. Page 83, we welcomed the continued increase in the number of looked after children. And we were particularly impressed on page 87 by the details of the participation and engagement activities with young people. I would love to have seen the risk assessment for when they went gorge walking, but there we are. It sounds tremendous fun, and I think some of us were quite jealous. And we also were pleased to see on page 87 the fact that we have the first outcome-focused framework in Wales, and that this is going to be rolled out nationally. So I could have gone on more, but those are the things that particularly struck us when we were reading through this report. I know that Helen Clark and Charlotte Galsworthy, councillors, both have questions about this. We'll go to Helen Kerry Clark first.
Thank you, Lynette. On page 75, it's showing that there's 101 people awaiting a care assessment. Whilst we all appreciate that, the pressures and the difficulties that you're experiencing at the moment with care assessments, I would like to know about the communication with the client who's waiting, because it has a knock-on effect on third sector organisations and your own sort of front door, in that if people are anxious that they're waiting, they will then contact third sector, who will then contact you to find out what the problem is. Whereas if it's communicated effectively in the first place, there doesn't need to be this to in and fro in. So I just wondered what your sort of protocol was with communicating with people about the length of wait and about the reason for waits?
If I may, Chair, there's a number of aspects to that question. So this is excluding carers assessments. Now, this is people who are assessed as requiring care. I don't know if Nune is on the call. Nune can speak about how we're piloting something IT-wise, very much along the lines as you would. You've made an inquiry or a contact with the local authority. Very much along the lines that you get with your dentist now. Your appointment is due X. Is Nune on the call? Sorry, she was at the beginning.
I am here.
Do you want to give two bits on that pilot we're doing in the front door?
Of course. So we're doing a pilot through a external kind of consultancy group called Social Finance. They were commissioned as part of Welsh Government. So we put in a bid to do that through our IT department. And we're one of the only local authorities in Wales kind of testing this out at the moment. What we've done is it's essentially a text message response system to keep individuals up to date about what's happening with their referral and the progress of their referral once it reaches our front door. So it starts from the point that contact officers answer a phone call in the front door in Spock, and they obtain consent from that individual to participate in the trial because it is a pilot. And individuals have been consenting quite openly, quite up for the being part of the pilot project, and we're getting really good outcomes from that. So we're in the second phase of that pilot at the moment, and what it is a text message, as I said. So an individual will get a text to say your referral has been received by our single point of contact. Your referral has been allocated for an assessment by our single point of contact. This is who your social worker is. These are the contact details, and we're kind of progressing that through the system then. So the text message system will follow the path of the referral then, so that the individual is constantly being updated every so often with timescales and an understanding of how long things should take. And then it leaves it open for them with the contact number to call back should they not get a response in the kind of expected general timescales that we give them. It's going very well. The general feedback from the public is really positive. People like the fact that they are being given notice of their timescales and what to expect. I think, as you said, Councillor Clark, I think for most people it's just knowing. It's not knowing that causes them to feel anxious or in limbo land. I think most people are quite happy as long as they know what to expect, and they're quite okay with and accepting of our timescales and some of the pressures that we're in at the moment, and we haven't had any negative feedback from that. It's been generally quite positive, and we are looking at how that can progress wider into the service and across the whole of the directorate as we progress through the pilot. So it is quite exciting, and it is having really positive feedback at the moment. And it is doing exactly what you kind of commented on, the importance of making sure individuals are updated and they know where they are, where their journey is in the pathway of being involved with social services.
Are you happy with that, Councillor Clark?
I am happy with that. Except I do have one further thing, is how are you planning to communicate with those who don't have mobile phones? There are still some people who are technophobes and don't have them. What's the communication with those people like?
Adrian, do you want to comment on that one? Is Adrian still with us?
It should be.
Well, where there's no communication, we'd be making visits. We wouldn't leave people in limbo. We'd actually, in the current situation we're in today, for example, we know we've got 59 people waiting in the community on a package of care. These are people who are reliant on families, friends, neighbours, etc., to keep them safe and well in their home. The mitigating factors we've got is that we're ringing these people every week. We're visiting them at least monthly and more frequently if we have to. If it's a breakdown situation, we will then be asking or stating you've got the opportunity of going into residential care. That is our last, that's not what we want to do. That's really not where we want to be. But for, just to reassure this committee, we haven't got any unsafe adults out there. We are, we know every package of care. We've brag rated every person. We are in a difficult position. I'm not going to hide the fact it's getting harder. It's getting much harder, but we're, doing all we can to keep people safe and well. And where we can't do that, they will be offered an admission into a care home on a temporary basis whilst we try and get a package of care. So if in terms of communication, if they haven't got mobile phones, we're visiting. We're out there.
Thank you for that. Nune, did you want to come back?
I was just going to say, just in terms of a recognition, so we did recognize when we set out with this pilot that not everyone will have access to a mobile phone, and that we would need to be creative for our population, parts of our population who don't have access to mobile phones, and that'll be cross-cutting. So that'll be, you know, your elderly population, that might be individuals with learning difficulties, that might be, it could cut across, couldn't it? And equally, individuals who may have phones may not have access to data, etc., etc. So there's limitations that might come in place because of deprivation or poverty that we're quite aware of. So we're going to test all of that out as well, because we don't want to exclude anyone. It was just a mechanism of seeing what an electronic text message response could work like, what could that look like, with the recognition that that wouldn't be a one size fits all, and that we would need to respond to each individual in their own needs, depending on what it is that they require for communication.
Thank you for that. Are you happy now, Helen? Yes. So, Councillor Goldsworthy, you had a question to raise about this as well.
My question, Angela, we spoke briefly about it yesterday, was obviously carers when they're at their wit's end and they just need some extra support. And obviously when they phone up, they're obviously then ensured that they're basically told any type of options that are available. And obviously I asked you about was Safe and Well as volunteers helping out with this.
Yeah. Absolutely. So just so that the committee is aware, we've now appointed a principal officer for early intervention, prevention, community development. So this will pull together all the preventative services that we have in adults. So you're looking at a community connect team, community independence team, Safe and Well team that was pulled together at the start of the pandemic. We're splitting that into two arms. One will be a befriending stroke sitting service. One will be a volunteer arm where we're picking up prescriptions, picking up the low-level shopping, that type of thing. And on top of that, we've also got the local area coordinators, so that they've been increased to 14 now across the patch. So between all of that, it's early days. Sarah's only been with us 8 weeks. We are now developing a structure under Sarah Waite to pull all of this together. I looked into the particular incident that Councillor Goldsworthy raised. Again, it's lost in transit. It's something we can do, and it's already being acted upon after the phone call yesterday. So we will be bringing regular updates to committee in the new year. It's part of the phase 2 of the remodelling of adult social care as well, where the preventative services will go into the networks in Neath, Avon and the Swansea Valley Pontedower area. So when we're having a discussion about an individual who's referred into the system, it will be talking about therapies, nursing, social work, prevention, etc. Because there may be other solutions before people need to come into statutory services. So that will be all singing and dancing in the networks. So I will be bringing that report in the new year, but that is the way forward. So Councillor Goldsworthy, in terms of the individual, that's been acted upon yesterday.
Thank you very much for that. Right, so are you happy now, Charlotte? Yes? Yes, good.
I'm always happy in that.
Good, good, excellent. That's lovely to hear. Right, page 71. It was just information. It's talking about the number of social work vacancies, but it doesn't tell us whether the number of social worker vacancies is better or worse than what it was before. It just tells us the status quo. So I just wondered, for future reports, could we see that? And also, could you give us a bit of an update now?
Yes, I can. Just so that I went through this report at length on Monday with our performance team and our HR colleagues. This report was put together many years ago, and originally it was at the time when Andrew Jarrett came into post, and we were looking in children's services specifically at social work vacancies, because there was a considerable issue at the time. We had high agencies and low actual local authority employees. This seems to have been added on over the years, and it's not really reporting accurately to members. It's not showing you what it needs to look like. So, for example, in adult services today, we've got 25% of social work deficit across all the teams. That would be the 3 network teams, the community mental health teams, the complex learning disability team. So that's we know exactly where our vacancies are. It's not the position we want to be in, but it's not as bad as it could be. But what I wanted to be able to say is that from January, our HR colleagues are implementing a new IT system, and by January we will have information that is today, up-to-date information that will tell you numbers, where, etc. So they've reassured me that between now and January, we will have a different style report for you at the next time we report this information, which will be a lot clearer. And just to say, we are actually employing one agency worker as at today. We do have one agency worker in adult services in our Avon network.
Right, thank you for that update, and I'm looking forward to seeing the new format of the report. That's excellent. I can see Kerry indicating.
Yes, just to add to that, really, briefly, I would say, as you've already sort of alluded to earlier, that we came in sort of 9 years ago, and we had 42 agency staff within children's services, and we've been everything for me is around the workforce. It's about looking after your workforce, and we've been very fortunate over many years now to have a stable workforce, and we've grown our own. We've done that for a very long time, and you'll see the benefits of that on this call. So, the principal officers just make me look good, and these are officers in Nooney and Chris Ray, Vic Smith and others, Ali Davis. These are officers that, that when we came in were social workers that were showing their worth. They not just show their worth, they show their grit and determination to stay with us in very difficult times, and they've come up through the ranks, and it's an absolute pleasure to hear them present today, and I'm as proud as ever when I hear them speak, as senior officers. So within children's services, it has, during the pandemic, you'll see that there's a national shortage of social work, qualified social workers across the country. Social workers are leaving the profession, sadly, and others, for the first time I've seen in any big numbers, are leaving frontline children's services, and some are going into adult social care. I mention Arthur again because it's important that that we do this. When you see high-profile cases of that nature on the TV and in the media, it does make social workers or perhaps students who are thinking of going into social work think twice. It is a tough job. So within children's services, we have seen some movement. For the first time, we are seeing a trickle of applicants coming into for consideration, and we've seen some vacancies. So we are in a more vulnerable position than we've been in for many years. But what I've loved about this is that the senior management team got together. We know lots of people, we have contacts, and we have a good reputation. And you are now seeing that start to tip, where in fairness to other local authorities and other workers, we've not had vacancies. So at one point, we had sort of an invisible waiting list where people were saying, how do we get in? And obviously those workers have gone on to be employed elsewhere. We've used those contacts, and now we're starting to see workers, senior sort of experienced social workers contacting us to say, okay, so we hear you've got some vacancies, and we're starting to have those conversations. So I'm not unduly worried, and I think within the next few months we will start to see more staff coming in from outside, and that's a good thing too. We do need to have that balance between growing your own staff, and then it's always healthy to bring some new blood in periodically.
Thank you very much for that. Yeah, and that just shows how if the reputation of the department is good, then people will get that message and will want to come and work here. Brilliant. Excellent. Right, that was Kerry. I can see no more indications or questions. The recommendation on page 55 is for monitoring. So are we happy to accept that? Yeah, I can see lots of thumbs up. Do I have to actually have a proposer and a seconder, Chloe, or do we just...
No, because it's just for noting, because it's monitoring purposes.
Thank you very much. Right, okay, we're now coming up to agenda item 12 on the Cabinet Papers, which is the Quality Assurance Framework for the provision of learning disability and mental health supported living services in Neath, Talbot. The reporting officer is Angela. Have you anything to add, or are you happy to go straight to questions?
I'm happy to go straight to questions. I don't think I've got anybody here from my team, so I'll do my best on this one.
Okay, you're flying solo. Right. Okay, where am I up to? Yes. Again, we have some good news. We loved the glossary on page 322 and the fact that we have easy read available in both languages. Thank you. We were interested that the family members on page 354 are very complimentary about the quality assurance framework. We very much appreciated the detailed reply on page 358 given to the issue raised by the staff member concerning the apparent differences between the quality assurance framework and the CIW requirements. That was a detailed answer. It really gave us a lot of reassurance. And we appreciated the answer given about communication on page 360, identifying that the Directorate now has an engagement team. So all of that was good news. Right, this question is definitely from me. My original question was, as I started to read it, why are some sections in red? So I went back to the executive summary and I couldn't find any reason as to why some bits were in red. So I guessed, as the report continued, that the red sections were amendments made in response to the consultation. And if that is the case, that's absolutely brilliant. But there's no reference to these being amendments anywhere until you get to page 368 in the IIA. So first of all, I wanted to check that I, and therefore the committee, have understood this correctly, that the red bits are amendments, and to also ask for any future reports. Can you put that earlier on in the report so that we don't get through to page 368 and then find the answer to the question that we were looking for? So can I have assurance that we have understood that correctly?
You have, Chair. Yes, and I'll take that back. Thank you.
All I needed was in the executive to say amendments have been made as a result of consultation, which is excellent news, but then I would understand what the red bits were. Right. Okay, the families made comments on page 354 about 3 issues: advocacy, whistleblowing, and property maintenance. We just wanted assurance that those items are being looked into and have been taken on board.
Absolutely, Chair. Yeah.
Brilliant. And that's it really, because it was very, very positive. I was delighted to see the positive comments from people. Right, now, this item is for decision and the recommendation excludes, members of the Fire Authority are going past, but however, this item is for decision. The recommendation is on page 315. I'll need a proposer and a seconder. Can I have a proposer and a seconder, please? Page 315.
Move, Chair.
Thank you. Can somebody second?
Second, Chair.
Thank you. Right, okay, so we've done that. Yes, we've done that bit. Right, and now we're to the forward work programme, which is given to us for information, which is on the scrutiny agenda. So thank you for these notes, Chloe. I don't know what to do without them. So we're now going back to the scrutiny agenda to look at the forward work programme. It's just for noting, but I'll give you 2 seconds to get back to scrutiny. I've done that bit. Yes. Anybody, any comments or observations? Chloe, you're indicating, what have I done wrong?
Nothing, Chair. I was just confirming that the mention of the presentation that Chris Frey-Davis mentioned, to come back to, to put on the forward work programme at a future meeting.
Yes,
just
please.
to note that we'll include that on the forward work programme.
Thank you, Chloe. That's a brilliant idea. Anybody else got any observations about the forward work programme, or are we okay to tick that one off? Nobody indicating. Brilliant. I cannot believe it is going dark, but there we are. It's nearly the shortest day. Right, now, urgent items. I can confirm we have one urgent item, which is the Director's annual report. I do want to comment at this point that we weren't too happy about getting this less than 48 hours before the committee meeting. However, we have chosen not to scrutinise the report as it is just for information purposes. We decided in pre-briefing, if members have any questions on the detail of the report, can I ask that at your convenience, you email the Director, copy in the rest of the members of the committee, so that if we see any issue that you have raised and anything with an answer from Andrew that we may wish to pursue further, we could include in our forward work programme. So we're not going to scrutinise it, and that's where we're up to with that particular one. Okay, just for anybody who wasn't in pre-briefing, are you happy with that? Suzanne, yeah? Okay, so, and Wyndham, thank you. Right, we now move to access to meetings. To resolve to exclude the public for the following items pursuant to section 100A, 4 and 5 of the Local Government Act 1972 and the relevant exempt paragraphs of Part 4 of Schedule 12A to the above Act. Can I please ask that the public or press in attendance now exit the meeting, and can the recording be stopped? And Chloe, can you let us know when the recording has finished?